Hello once again and welcome back to K24 Alfajiri. It's our Wellness Wednesday and today our main focus is going to be on breast cancer. Did you know that breast cancer is the most common invasive cancer in women, and also it is the second most common cause of cancer after lung cancer? Well, joining me in this conversation is Dr. Andrew Odhiambo. Karibu sana to K24 Alfajiri.
Thank you.
And then we have Susan Ngutu. Karibu sana to K24 Alfajiri.
Thank you.
Kindly just introduce yourselves and tell us what you do. Let me start with Susan. Unafanya kazi gani?
I am Susan Kavata Ngutu. I'm a personal secretary by profession.
Okay.
Yes.
So,
I'm a cancer survivor.
okay.
Yes.
We're happy to have you here.
Thank you.
Dr. Andrew?
My name is Dr. Andrew Odhiambo. I am a medical oncologist and a lecturer at the University of Nairobi.
Karibuni sana. We are so happy to have you.
Asante.
Susan, you are a cancer survivor.
Yes.
Wow.
Yes.
Amazing.
Yeah.
But before we actually get into delve much deeper in breast cancer, Susan, labda unaweza ukatuelezea story yako, vile ulipata cancer, vile ulikuwa diagnosed, na kama ulikuwa unatarajia ya kwamba daktari atakwambia uko na cancer.
Okay. Well, it was in the year 2009, in February, I discovered I had a lump on my right breast. Yes, and then this lump grew. It grew. Okay, I didn't take action immediately because actually at that time I was believing it will disappear. Okay, I was taking some supplements, so I thought this growth would disappear with time. But the growth kept on growing and growing until it reached a point where the nipple got inverted.
Okay.
The nipple went inside.
Yes. So this is after how long?
This is after about 6 months.
Okay.
Yes. So when the nipple got inverted, I thought there was a problem. So I had to go and see a doctor. I went to see a doctor at Aga Khan Hospital, Mombasa, and who did a test on me and told me that after the test, I discovered that I had breast cancer stage 3. Yes. Yes. So, yeah.
So at no given point, when you had the lump, did you think that this might be breast cancer?
No. I didn't think this is breast cancer.
Okay.
I thought it was just an ordinary lump.
All right.
So I got alarmed when the nipple got inverted.
Yes.
Because now I thought this is not normal. Yes.
Okay.
Yes.
So after the doctor told you that, Susan, you have breast cancer, how did you take it?
Wow. At first, I got shocked because I thought, why me? You know, I thought this disease got ni ugonjwa masonko.
Yes.
Yes. From what I'd heard.
Ni ya masonko pekee. Daktari, is that true? Okay.
So I got shocked. So, yeah, so the doctor said now we have to have this, because it's already stage 3, there's no way we can remove the lump. So I had to have the whole breast removed. So I went to Kijabe Mission Hospital and had the whole breast removed. Yes.
Okay.
Yes.
How did this affect you as an individual, socially, at work, your family?
Wow. As a woman, it affected my self-esteem. Yes, because now I was conscious now that my appearance has changed. So I actually had to buy a lot of scarves to put on this side.
To cover one side.
To cover this side.
Yeah.
Because I noticed as I walk, people were staring at my chest. Yes. And at that time, I had not heard about prosthesis. I didn't know there was something called prosthesis you could put in there. So I invested in a lot of scarves. And then anytime I went out, I had to make sure I had covered myself. Yes.
Okay.
So it affected my self-esteem as a woman.
Okay.
Yes.
And your family, maybe your children, your husband?
Okay, they gave me a lot of support. Yes, a lot of support.
Okay.
Yes.
Okay, so you have said that the one breast had to be removed.
Yes.
Okay, and did you have any side effects, maybe much later?
From the surgery?
Yes.
No, the side effects came from the chemo.
From the chemotherapy?
I had to undergo 6 sessions of chemotherapy. Yes, that affected me tremendously because I experienced a lot of nausea. Every time after the session, yes.
yeah?
every time I had chemotherapy, I would really feel like vomiting. Anytime I smell food cooking, it really, and it also affected my appetite. It also affected my taste buds. I could not taste the taste of food.
Oh.
Every food was bitter, even water. When I drank water, it was just bitter.
Okay.
So it affected my taste buds. And then later on, my hair fell. Yeah.
Okay.
So I had to invest in wigs.
Yeah.
Yes.
Okay.
Yes.
But look at you here today, wearing pink, looking lovely. You are a cancer survivor.
Yes.
I mean, how long did it take for you to be cancer-free?
Well, after I had the chemos for almost 1 year. Yes.
Okay.
So after the chemos, the doctor said I don't need radiotherapy. Yes.
Okay.
Yes.
So, Doctor, sorry for leaving you out in this conversation. Now back to you. Let's just try to understand the causes of breast cancer.
Sorry, I'm a bit of a sore throat, but
Yeah, sorry.
it's not only one cause specifically.
Yes.
In fact, up to 60% of the time, we don't know why females are getting breast cancer. Even men can get breast cancer. But we have certain risk factors which would predispose a woman to developing breast cancer later. For example, if you start your periods early, you know, if you have longer exposures to the estrogen hormone, if you have your first child after 30 years, you know, if you're not breastfeeding for long durations, all those risk factors have to do with estrogen exposure.
Wow, okay.
Obviously, excessive alcohol consumption,
Yeah.
smoking and obesity in females
Yeah.
contributes a lot towards breast cancer. And family history is quite important. About 5 to 10% of all breast cancers are thought to be familial, meaning that there's a genetic problem in your family, and if your mom had it, then you have a higher chance of you getting it if your auntie or if your grandma had it.
Yeah.
So there are certain risk factors that come together to predispose oneself towards developing breast cancer. But it doesn't mean that if you don't have those risk factors, you can't get breast cancer. You still can, and that's why we advocate that one must go for screening every year when time is due. You know, always check yourself every month. Go to your doctor to get checked. If you need your mammogram to be done once every 1 to 2 years, make sure that it's done, and just be vigilant and know your body and know when something is wrong, not to stay for too long. 9 out of 10 lumps in the breast don't turn out to be cancer.
To be cancerous,
but the 1 out of 10 could be, so we don't have to wait for it to invert or to change the skin color or for it to grow very big for it to go to hospital. The earlier it is caught, the higher your chance of getting cured.
Okay. So the earlier it is detected, the higher the chances of you getting cured.
If you're stage 1, stage 2 breast cancer, the chance of cure is in excess of 90%.
Okay.
Yeah.
Speaking of stages, we have 4 stages of cancer.
Yep.
Can you just take us through each and every one of them and the difference between the first stage to the last stage?
So really, it depends upon the size of the tumor and whether it has gone into the nearby lymph nodes, and also whether it has jumped out of the breast into another organ. So stage 1, 2, and 3 are all confined to the breast principally. Most of the stage 3 cancers have already invaded the lymph nodes in the armpit. And then once the cancer jumps out of that area and maybe goes to the lungs, to the brain, to the liver, or to anywhere else, then that becomes stage 4. But I must emphasize that not all stage 4s are the same. You know, people hear stage 4 and they think the next day they're going to be buried.
To die, yeah.
I've had stage 4 breast cancer live over 15 years just okay and be fine. It depends on where it has spread to.
Yeah, yeah.
If it spreads to your brain, to your heart, you know, to the liver, critical organs, your survival might be shorter. But if it's just gone to one rib or to the spine, I mean, you can live a normal life with stage 4 breast cancer and just look like any other person walking in the street. So talk to your doctor, understand what type of disease you have.
Yeah.
Not all breast cancers are the same. Breast cancers, they differ in so many small different ways, you know, depending on whether they respond to estrogen or other drugs, you know, how fast they are multiplying. So your doctor should actually explain to you, yes, you have breast cancer, but what type of breast cancer do you have? What is the behavior?
Yes.
I usually tell my patients, you know, you can be a teacher, you can be in class teaching, you have 20 students. There'll always be one who is a bit upside down,
Absolutely. Yes.
he's running
There's
all over the place,
learner,
and then there's the slow learner.
Yes.
So cancers differ like that, despite all of them being in the same uniform. You must understand what type of cancer you have. Yeah.
And on the same note, I'd like to invite our viewers to ask any question that you have in regards to breast cancer, because we have Dr. Andrew here in studio. This is free consultation. So send us all those text messages and reach us out on our social media platforms. Just remind you that our Facebook page is K24TV, Instagram and Twitter is at K24TV. And you can actually call us live in studio on the numbers right below your screen. And Dr. Andrew Odhiambo will be ready to answer all the questions as pragmatic as he can. And as we even talk about the difference in breast cancer, maybe you can also just tell us the symptoms that we can look out for.
So the first and easiest symptom is a breast lump.
Okay.
So if you feel any swelling in your breast, then you must be on high alert and you must go and see the doctor. Don't imagine that it's just something that you can rub away and it will disappear.
Yeah.
Probably not. And especially if you're older, 40, 45 and above, if you get any breast lump, please, the same day, go and get checked. Yeah.
Okay.
If you have any other changes in your breast, including skin changes like reddening, dimpling, inversion of the nipple, and very rarely you can have a bloody nipple discharge. Men can get breast cancer, so don't be sitting at home and imagining that you are scot-free, although it's quite rare.
And that's the thing that
and
we
it's
all
most
ignore,
common
because we
in,
think breast cancer is associated with women. Senior Susan?
I've had breast cancer male patients, as young as 33, 34. And any swelling in the breast, really, male or female, you have to get checked. Any swelling in the armpit, sometimes the breast cancer can start growing in the armpit up instead of in the actual breast. So you have to make sure that you're checked. If the breast size, is appearing different, you have to know your breast. That's why we encourage you to check yourself regularly, so that if you feel any change in the consistency, then you have to get checked immediately. Going to the doctor quickest makes a very big difference. If this clinician in front of you is not on high alert, say respectfully, thank you, I'm going to find another opinion, and find that person who will address your problem until it goes away. I must highlight that there's a special group of patients who struggle a bit, and those are breastfeeding women, because their breasts are lumpy all the time, and they're milky, and they have, they change consistency a lot. And for them, it's very hard to pick up changes. But if you notice that one breast is struggling, the milk supply is a bit different, or if you feel a lump and you know that it wasn't there, then just go and get checked. Many breastfeeding mothers, they come with very huge lumps, and you can imagine somebody's breastfeeding, they've got a 10-centimeter tumor in the breast because they don't know. So if you notice any difference, just get out of your house, get into an Uber or a Matatu, go to the doctor and make sure that you're checked.
Yeah, and I'm so happy that you mentioned about, you have to go to the doctor, because most of the time what we do is to go, Google is your friend. And once you go on Google, she'll tell you something totally different. You're in your grave right now. In fact, you're dead, and give you very different opinion. And you mentioned that there are different types of breast cancer. If you could just highlight those for us and explain in detail.
Without being too technical, because sometimes some of the complexities are very difficult and they come out from your biopsy report. But there are different types, probably about 4 or 5 different types of breast cancer. And what will make this difference is from the biopsy report that the doctor gives you, that the sample was taken and looked at in the microscope, and the pathologist saw that this cancer behaves in a certain way and it responds to certain signals in the body. The most common one are those that are estrogen receptor positive, So that means that those cancer cells, when estrogen is fed onto them, they grow faster, and therefore if you have drugs that block the estrogen pathway, then those drugs are beneficial. And many women out here in our country are on drugs like tamoxifen for like 5 to 10 years, and those drugs are very useful because that type of cancer responds to that type of treatment. And then you have those that their estrogen receptor probably negative, and then they have different treatments. Then you have a very special category, we call them triple negative breast cancer, meaning for all the signals that we test, then they're negative for all of them. then those ones behave slightly different, tend to be aggressive in younger women. You know, sometimes it can be running in your family. So those little differences are what advises me and my other oncology colleagues on how we shall treat you, which drugs we shall treat you with. Do you need surgery? Do you need radiotherapy? It's not a one blanket statement for everyone.
Absolutely.
It is that characteristic of the tumor that helps me decide exactly how to treat you and the sequence in which to treat you.
Yeah. And
you know, people, allow me to say this also, people get cancer and the first thing they want to do is travel abroad for treatment. She's been treated fully in the country.
Kenya, yes.
And you know, nothing fancy, you know, just surgery and you had chemo. Sorry you had a rough time with the side effects, but it doesn't have to be that way nowadays. We have much more newer drugs, safer ways of doing it. We have a lot of support therapy that we give patients and they do not have to undergo nausea. In fact, right now, more than 90% of the patients will develop any nausea, you know, at all. We have even sophisticated ways of preventing hair loss in special types of cases. So it's getting better and it doesn't have to be so complicated. Just simple maneuvers and you can actually be cured from breast cancer if you are detected early.
Earlier, all right. And we shall be talking about the treatment just in a few minutes. But before that, Dr. Even as we talk about, you know, the technology advancing and now we have newer ways of, you know, treating cancer, there's still a very high number of cancer patients, and each and every day there's someone who's diagnosed with cancer. Why is it rising so dramatically?
So this is not just true for breast cancer only, but many cancers. And we are now beginning to understand some of the risk factors that were not there, you know, in the 70s and the 80s. And what we seem to think is the common denominator now is the issue of overweight and obesity. If you look at cancer of the breast, cancer of the colon, cancer of the uterus, cancer of the pancreas, cancer of the lower part of the esophagus, some special types of bone cancers, and you know, blood cancers. If you look at the common denominator, it's obesity and overweight. And you know, the people in England and America and Europe have realized this and are beginning to put in measures to reduce overweight and obesity in the general population widespread. So schools are now getting playgrounds and it's becoming legislation for you to have places for people to exercise, you know, parks.
Absolutely.
If you walk into McDonald's now and you look at the menu and there's a hamburger and fries, there has to be a healthy alternative side by side. And the calories have to be displayed so that the individual can pick what is a healthier option, and that is in the law. Whereas in Kenya, now is when KFC is opening branches all over the places. I'm not anti-KFC, but if we don't curb overweight and obesity, the cancers will just keep on rising. And if we don't educate people from grassroots level, you know, cancer should be in the primary school textbook, the same way HIV is.
Very true.
And how to reduce your risk in terms of keeping your weight low, avoiding alcohol, cigarette smoking, and being vigilant should be taught from primary school, secondary school, university, so that you don't get to 50 years, you know, you are 100 kilos and you wonder how you got there and you have breast cancer. And it's
So I wouldn't be wrong to say that it is more of a lifestyle disease.
That's true.
Okay. Susan, did you change anything now after you were diagnosed with cancer? Your lifestyle, what you were eating before, exercising?
Yes, I changed my lifestyle, especially my diet. Yes, I watch what I eat. I avoid anything that has any processed meat. Sorry, any processed kind of food. Yes. Even processed maize meal. These days I take my ugali whole. I go to the supermarket. Sorry, I go to buy the maize whole and take it to a meal myself. I take a lot of grains. Yes, I avoid red meat. I very rarely, once in a while. I avoid red meat. I take a lot of white meat. Yes, a lot of fruits and vegetables. I don't take sodas these days. Sorry, I don't take Royco. Any food coloring. Yes, any food coloring, flavors, stabilizers, all these are just chemicals. Stabilizers, you name them, food colorings. I don't take them. I do healthy. These days, I'd rather fry my food with kitungu saumu and tangawizi than put Royco.
Yeah.
Yes.
Okay.
So I watch what I eat. I take brown rice, I take brown chapati. If I have to take bread, it has to be brown.
Brown bread, yeah.
Yes.
Okay.
So I take as much as possible, I do everything natural. I prefer taking ngwashe, nduma to bread. Yes.
Okay.
Yes.
So
and if it's juice, it has to be fresh juice.
Freshly squeezed juice, yeah?
Freshly squeezed, not the one in the bottles.
Yes.
Sorry.
Oh, okay.
I know I'm...
No, it's okay. We totally understand.
Yes.
All right. The other thing that I'd like to ask you, even you being a cancer survivor,
yes.
How has this changed, and have you done anything, you know, in creating awareness?
Yes, I'm a member of Breast Cancer Kenya group. So we create awareness. We create awareness in the group. We also do free testings. Once in a year, we organize for free testing. Yes.
Okay.
Yes.
Sawa sawa. And we shall now take a short commercial break, and then when we come back, we continue with the discussion. We talk about the treatments and the prevention. And then on the other side of the studio, I'm joined by two very incredible people that I cannot wait for you guys to meet them, because we are talking about mastectomy bras. Do not go anywhere.